I'm Dr. Elzie Hart. Been here in Morganton for many years. Trained in Chapel Hill at the university there. Had lived all my life in the Piedmont and decided I liked the mountains. And when I first came here, I was actually the first ENT in the area. And that went all the way from Sparta, North Carolina to Mountain City, Tennessee. And then over the years, I've practiced general ear, nose, and throat, doing all the various procedures and treatments that you do with this particular type of specialty. What I really like about it is it varies and covers the whole gamut of everything from children to elderly adults and everything in between. And about the mid-90s is when I began to notice that, or pay a lot of attention to the fact that a lot of my patients really had significant allergy problems that couldn't be handled that well with over-the-counter medicines. And then over the years, as they've developed, what's interesting, many of them are over-the-counter, and a lot of insurances won't even cover prescriptions anymore. So in the mid-90s, I did a secondary training and got a fellowship in subspecialty of allergy of ear, nose, and throat. And I've enjoyed that ever since, because we see quite an improvement in our patients that we couldn't get any other way with surgery or pills or whatever you want to talk about. And over the years, we developed a good patient base that we feel like get good results. We do our own testing in-house. We mix our own vaccine, and patients really feel good about the results they're getting, and become like family almost, because they come in on a regular basis for their allergy shots. We work with them on a first name basis. Everybody knows who they are coming in the door, and a little chit chat of, have you fixed your carport that got smashed by the snowstorm, and or whatever's going on at the time. And we find good results with what we do. Well, this area is interesting in that I've had some people who know some botany to a degree tell me that this particular area has as many, if not more, flowering type of plant species, etc., than most anywhere else in North Carolina or even southeastern United States. The second part of the picture is that as the winds are coming off the mountains, they're carrying whatever pollens and materials they have in that area, and about the time they get to our area, the foothills, it starts to drop out of the wind currents, and so we get almost a double whammy. So that's just for the seasonal type of things. And then the other part of the picture is the perennials, which are a year-round thing and have more to do with what's inside houses and buildings and places of work and this type of thing. And it's been pretty well established that at least 60-some million of people in the United States suffer from allergies on a regular basis. It probably contributes to the most reasons for being out of work. A good 15 million work days a year are probably lost secondary to allergy problems and or complications from it, such as sinus infections, asthma, etc. And so I like to look at it as a big part of the preventive medicine picture, and that everything we can do to keep people well, then they're able to stay at work, not have to miss work, not have to miss school, etc. And employers are happy, and teachers and principals are happy. The body has a normal immune system that everybody has. And this immune system is designed really to help fight off viruses, bacteria, and these type of things considered foreign bodies to our system that would make you sick. What allergy is all about is when your immune system overreacts to things like pollen, dust, mold, mildew, and suddenly determines that they are bad actors as well. And then your body starts to form what's called IgE, is a particular immunoglobulin, that then the next time you come in contact with whatever it is, then boom, the body considers it a bad actor as well, and tries to fight it off. So in the process of doing that, histamine is then produced, which irritates the lining of the nose, the lining of the eyes, cells in the nose, etc., and make you sneeze, make your nose run, make your eyes water and itch, mouth, and then can lead to things like headaches and abdominal discomforts, etc. And so part of counteracting this is initially identifying what specifically the person is allergic to so we can treat it directly. And our particular method is designed to help determine not only what a person is allergic to, but what degree, because you may be sensitive to ragweed, you may be sensitive to fescue, the most common grass plant in this area, or maple trees, but you may be much more sensitive, say, to maple trees than, say, to ragweed. And fescue may be in between. Well, once we determine not only what a person is allergic to, but what degree, then we can mix a vaccine to treat appropriately and a little more rapidly what their problem is. And I explain to patients it's like a reverse horse race. I take the strongest horse, or the things you're most sensitive to, in the back, or mix them very weak. The weakest horse, which is the things you're not as sensitive to, and mix them a little stronger, put them in the front, and everybody gets to the finish line at the same time. So part of the problem with treating allergies is if you move things too rapidly, sometimes they start having reactions to the shots, and that's the thing we want to look for carefully. And of course, when we're using allergy vaccine or shots, we do it in the office and have people wait a good 20 minutes afterwards to make sure they're not going to have any problem from it before we let them go about their way to work, to business, home, or whatever. So we're trying to do everything as safe as we can. We kind of double check mixing, double check every stage of the way in terms of mixing up our vaccine and this type thing. Plus, when we start a person with a new bottle, we do what's called a test wheel, which is just a little tiny minute amount in, just initially on the first bottle, to make sure it's mixed correctly and there's not going to be something too strong to cause some kind of reaction we don't want to have. And if so, we catch that right off the bat and adjust our mix accordingly.